I was trying on wedding dresses when my phone rang. The doctor's voice was gentle but devastating. The biopsy results show cervical cancer, and given the location and stage, pregnancy may not be possible. I was 29, getting married in 6 months, and suddenly my dreams of being a mother felt like they were slipping away. I remember standing in that bridal boutique, surrounded by white tulle and satin, feeling like the most beautiful dress in the world couldn't hide the ugliness growing inside my body. The sales associate, a sweet woman named Margaret, noticed my face had gone pale. "Honey, are you all right?" she asked, her hands still holding the train of the dress I'd fallen in love with just minutes before. I couldn't speak. I just stood there, in front of the three-way mirror, seeing my reflection multiplied endlessly. A woman in a wedding dress who might never be a mother. The irony was crushing. I was about to marry the love of my life, but the future we'd planned together was already being torn apart. My name is Emma Rodriguez, and I've been planning my wedding to David for almost a year. We met in graduate school. I was studying to be a pediatric nurse. He was finishing his residency in family medicine. We bonded over our shared dream of having a house full of kids someday. David always joked that between my nursing background and his medical training, we'd have the healthiest, best cared for children in the neighborhood. Children. We'd already picked out names. Sophia Grace for our first daughter, after my grandmother who'd raised me when my parents died in a car accident when I was 12. Gabriel David for our first son, combining both our father's names. We had this whole plan: get married in June, take a honeymoon in Italy, then start trying for a baby right away, since I was already 29 and didn't want to wait much longer. The abnormal pap smear came back just 3 weeks before my dress shopping appointment. Dr. Sandra Peterson, my gynecologist since college, had called it a slightly irregular result and scheduled me for a colposcopy. She made it sound routine, like getting your teeth cleaned. "These things are usually nothing to worry about," she'd said. "Probably just some cellular changes from an old HPV infection. We'll take a biopsy just to be thorough." HPV, human papillomavirus. I'd learned about it in nursing school, knew it was incredibly common and usually harmless. Most sexually active people get it at some point in their lives, and their immune systems clear it without them ever knowing. I'd been with David for 4 years, and we'd both been tested for everything when we first got together. How could something so common be threatening everything I'd ever wanted? The biopsy was uncomfortable but quick. Dr. Peterson used what looked like tiny scissors to snip small pieces of tissue from my cervix while I lay on the exam table, trying to focus on the ceiling tiles instead of what was happening below. She chatted casually during the procedure, asking about wedding plans and whether David and I were excited about starting our lives together. Any thoughts on timing for children? She'd asked, completely unaware that she was about to destroy that possibility. I always tell my patients that if you're thinking about getting pregnant within the year, we should discuss prenatal vitamins and folic acid supplementation. I'd smiled and told her we were hoping to start trying right after the honeymoon. She'd smiled back and said she looked forward to seeing me for prenatal care. 2 weeks later, she was the one delivering news that would change everything. Standing in that bridal shop, I finally found my voice. "I need to sit down," I told Margaret, who immediately sprang into action, bringing me water and helping me out of the dress with practiced efficiency. "Take all the time you need, sweetheart," she said. "Wedding planning can be overwhelming." If only it were that simple. I called David from the parking lot, my hands shaking as I dialed his number. He was between patients at the clinic where he was doing his residency, but he always answered when I called. "Hey babe, how did the dress shopping go? Did you find the one?" I started crying before I could get the words out. "David, I need you to come home. We need to talk. Emma, what's wrong? You're scaring me. The biopsy results came back. It's cancer. The silence on the other end of the line lasted forever. When David finally spoke, his voice had shifted into that clinical tone he used when he was processing difficult medical information. What kind of cancer? What stage? Who did you talk to? Dr. Peterson called. She said cervical cancer, stage 2B. David, she said pregnancy might not be possible. I heard him take a shaky breath. I'm coming home right now. Don't drive anywhere, okay? Just wait for me. The next few hours passed in a blur of medical terms, research articles, and phone calls to specialists. David's medical training kicked into high gear, and he started making lists of questions for oncologists and researching treatment options. I sat on our couch, still wearing the jeans and sweater I'd put on that morning for dress shopping, feeling like I was watching someone else's life fall apart. Stage 2B, cervical cancer meant the tumor had spread beyond my cervix into the surrounding tissues, but thankfully not to the lymph nodes or distant organs yet. Dr. Peterson had referred me to Dr. Amanda Martinez, a gynecologic oncologist at OHSU, for further evaluation and treatment planning. The good news, Dr. Peterson had explained during our follow-up call, is that cervical cancer is very treatable when caught at this stage. The 5-year survival rate is excellent. Survival rate. I was 29 years old and thinking about survival rates. But what about children? I'd asked. What about pregnancy? That's when the conversation got complicated. Standard treatment for stage 2B cervical cancer typically involved a combination of chemotherapy and radiation, followed by a radical hysterectomy. The word radical meant they'd remove not just my uterus, but also my cervix, upper vagina, and surrounding tissues. It was thorough, aggressive, and would make pregnancy impossible. There might be other options, Dr. Peterson had said carefully. Dr. Martinez is an expert in fertility-preserving treatments for young women with cervical cancer. But Emma, I want you to understand that these approaches are more complex and may carry higher risks. Higher risks. Everything seemed to come with trade-offs now. Our appointment with Dr. Martinez was scheduled for the following Wednesday. David took the day off from his residency, and we drove to the hospital in tense silence. I kept thinking about all the pregnant women I cared for as a nurse, how I'd always imagined myself in their position someday. Now I was walking into an oncology office instead of a maternity ward. Dr. Martinez was younger than I'd expected, probably in her early 40s, with kind brown eyes and an impressively calm presence. Her office was decorated with pictures of babies, patients' children who'd been born after cancer treatment, she explained. It was both hopeful and heartbreaking. Tell me about your family planning goals, she said after reviewing my pathology. Results. I know this is an overwhelming time, but I need to understand what matters most to you so we can design the best treatment plan. I looked at David, then back at Dr. Martinez. We want children. Multiple children. It's been our dream since we started dating. I can't imagine my life without being a mother. She nodded thoughtfully. There are several approaches we can consider. The traditional treatment would be concurrent chemoradiation followed by surgery, which would cure your cancer but eliminate your ability to carry a pregnancy. However, there's also a fertility-preserving option called a radical trachelectomy. She drew diagrams as she explained. A radical trachelectomy would involve removing my cervix and the upper part of my vagina, but leaving my uterus intact. She'd then create a new opening by stitching my uterus directly to the remaining vagina, preserving my ability to get pregnant while removing the cancerous tissue. The success rates for cancer treatment are slightly lower than traditional surgery, she explained. And pregnancy after trachelectomy carries increased risks, higher chance of miscarriage, preterm delivery and the need for a C-section, but many women have successfully carried healthy babies to term. David was taking notes, asking detailed questions about survival statistics and complication rates. I was trying to wrap my head around the fact that we were discussing major surgery that would rearrange my internal anatomy, just so I could possibly have a chance at pregnancy. What would you do if you were me? I asked Dr. Martinez. She paused, considering her words carefully. That's not a decision I can make for you, but I can tell you that I've had patients choose both paths, and I've seen beautiful outcomes with each approach. The question is, what kind of risk are you comfortable with, and what would you regret most if you couldn't have it? We scheduled the surgery for 3 weeks later, after I'd completed 2 cycles of neoadjuvant chemotherapy to shrink the tumor and make the operation technically easier. It meant postponing our wedding by 6 months, but David was adamant that my health came first. The wedding can wait, he said as we drove home from the appointment. Our marriage is more important than one day, and I need you alive and healthy before anything brutal. I'd expected to feel sick. Nursing school had taught me about the side effects of cancer treatment, but experiencing it firsthand was completely different from reading about it in textbooks. The nausea was relentless, lasting for days after each infusion. I lost 15 pounds in the first month, and my hair started falling out in clumps by week 3. David shaved his head in solidarity when I decided to cut off what remained of my hair. We looked like a couple of cancer patients, which I guess we were in a way. Cancer doesn't just happen to one person in a relationship. It happens to the whole family. My colleagues at the pediatric intensive care unit where I worked were incredibly supportive. My manager, Sarah, immediately approved my medical leave and assured me that my job would be waiting when I was ready to return. Take care of yourself first, she said. Those babies will still need good nurses when you're better. The surgery was scheduled for a Friday in October. Dr. Martinez estimated it would take about 4 hours. Assuming there were no complications, David's parents drove down from Seattle to be with us, and my best friend, Jessica, flew in from Denver. I was terrified, but determined. Whatever happens, I told David the night before surgery, I want you to know that I love you, and I don't regret trying to save our chance at having children. He kissed my forehead. You're the strongest person I know. Tomorrow is going to go perfectly. The surgery did go perfectly from a technical standpoint. Dr. Martinez was able to remove all visible cancer while preserving my uterus and ovaries. The pathology report showed clear margins, no cancer cells at the edges of what she'd removed. I'd need additional chemotherapy, but the hardest part was behind us. Recovery was slow and painful. I couldn't lift anything heavier than 10 pounds for 6 weeks, which meant David had to help me with everything from grocery shopping to doing laundry. The most challenging part was the uncertainty about whether the surgery had actually preserved my fertility. We wouldn't know until we started trying to conceive, which couldn't happen until I'd completed treatment and been cancer-free for at least 6 months. The additional chemotherapy was easier than the pre-surgery cycles, but it still wiped me out completely. I spent most of December and January on the couch, watching Netflix and trying to keep food down. David was finishing his residency and studying for board exams, but he never complained about taking care of me on top of everything else. By February, my scans were clear, and Dr. Martinez cleared me to start planning our wedding again. We'd rescheduled for September, giving me time to fully recover and hopefully regain some of the weight I'd lost during treatment. Wedding planning. The second time around felt different. Everything seemed more precious, more meaningful. I wasn't taking any of it for granted anymore. When I went back to the same bridal boutique where I'd received my diagnosis, Margaret remembered me immediately. Oh, honey, how are you feeling? she asked, genuine concern in her voice. I'm better, I said, much better. And I'm ready to find that dress again. The same dress I'd fallen in love with still fit perfectly, even though my body had been through so much. When I looked in that three-way mirror this time, I saw a cancer survivor in a wedding dress. I saw a woman who'd fought for her dreams and won. Our wedding day in September was absolutely perfect. The weather was gorgeous, our families were all there, and I felt healthier and stronger than I had in over a year. David cried when he saw me walking down the aisle, and I knew it wasn't just because I looked beautiful. It was because we'd made it through the hardest year of our lives together. But on what was supposed to be the happiest day of my life, I collapsed in my wedding dress. The cancer had spread, and suddenly our I-do's might become goodbyes. It happened during our first dance. David and I were swaying to At Last by Etta James, surrounded by all our friends and family, when I suddenly felt dizzy and nauseous. At first, I thought it was just excitement and the stress of the day, but then sharp pain shot through my abdomen. Emma, you're really pale. David whispered in my ear, are you okay? I tried to smile and keep dancing, but the pain was getting worse. I think I need to sit down for a minute. David immediately guided me to a chair, his medical training kicking in as he assessed my symptoms. My maid of honor, Jessica, noticed the commotion and rushed over. What's wrong? She asked, kneeling beside my chair. I don't know, I said, trying not to panic. My stomach really hurts and I feel like I might throw up. David was already feeling for my pulse and looking at my coloring. We need to get you to a hospital, he said quietly. This isn't normal. The ambulance ride to the emergency room and my wedding dress was surreal. The EMTs were gentle and professional, but I could see the concern in their eyes. David held my hand the entire way, still wearing his tuxedo, both of us trying to process what was happening. It's probably just stress, I kept saying. Wedding day nerves, right? But deep down, I knew this felt different. This felt like cancer. The CT scan in the emergency room showed what we'd been afraid of, new lesions in my liver and lungs. The cancer had metastasized while we weren't looking. Dr. Martinez met us at the hospital still wearing the cocktail dress she'd put on to attend our wedding reception. I'm so sorry, she said, reviewing the images with us. This is not what any of us expected to see. Stage 4 cervical cancer. The words hit like a physical blow. Everything we'd been through, all the treatment and surgery and careful monitoring, none of it had been enough. What does this mean? David asked though. As a doctor himself, he probably already knew. It means we need to shift our approach, Dr. Martinez said gently. We're looking at palliative care now, focused on quality of life and buying as much time as possible. Time. Suddenly, that was all we had to work with. The next few months were a blur of aggressive chemotherapy, radiation treatments, and experimental protocols. I took a permanent leave from nursing, spending my days in infusion centers and doctors' offices instead of caring for sick children. The irony wasn't lost on me. David deferred his fellowship to take care of me full-time. We moved back in with his parents in Seattle so I could be closer to the cancer center there. It felt like we were moving backwards, like all the progress we'd made as independent adults was being erased by this disease. But something unexpected happened during those dark months. I started responding to treatment again. The lesions in my liver began shrinking. The spots in my lungs disappeared entirely. My tumor markers dropped to nearly undetectable levels. I've never seen anything like this, my new oncologist, Dr. Patricia Kim, said during one of our appointments. Your response to this treatment protocol has been remarkable. By our first wedding anniversary, I was officially in remission again. The cancer was still there. It would always be there. lurking, but it was controlled. Dr. Kim said I could expect years of good quality life, maybe even decades if I continued responding well to maintenance therapy. What about children? I asked the question that had been haunting me for 2 years. Is it safe for me to get pregnant? Dr. Kim exchanged glances with David before answering. Pregnancy would mean stopping your maintenance chemotherapy, which could allow the cancer to progress. It's a significant risk, but it's possible, I pressed. Biologically, yes. Your uterus and ovaries weren't damaged by treatment. But Emma, I need you to understand that pregnancy could literally be a matter of life and death for you. David and I talked about it for weeks. We consulted with fertility specialists, maternal fetal medicine doctors, and multiple oncologists. Everyone said the same thing. Pregnancy was possible, but dangerous. Very dangerous. I can't ask you to risk your life for a maybe, David said one night as we lay in bed. I love you more than I love the idea of having children. But what if this is our only chance? I asked. What if the cancer comes back anyway, and we never even tried? 3 months later, I found out I was pregnant. The 2 pink lines on the pregnancy test felt like winning the lottery and jumping off a cliff at the same time. We'd agreed to try for 3 months, and if it didn't happen, we'd accept that children weren't in our future. But it did happen, on the very last cycle before our self-imposed deadline. Are you happy or terrified? David asked, staring at the test. Both, I said honestly, completely both. The pregnancy was monitored more closely than any in medical history and pretty. Sure, I had appointments with my oncologist, maternal fetal medicine specialist, and regular obstetrician every 2 weeks. We did ultrasounds constantly, checking both the baby's development and my cancer markers. For 7 beautiful months, everything went perfectly. The baby was growing normally, and my cancer remained stable. I felt healthier and more energetic than I had since before my diagnosis. David started believing we might actually pull this off. But at 32 weeks, my tumor markers started rising again. We need to deliver the baby now, Dr. Kim said during an emergency appointment. Your cancer is becoming active again, and we need to restart chemotherapy. Rodriguez's son was born at 32 weeks gestation, weighing 4 pounds, 3 ounces. She was tiny and perfect, with dark hair like mine and David's brown eyes. The NICU team whisked her away immediately, but not before I got to touch her little hand and tell her I loved her. She's going to be fine, the neonatologist assured us. 32-weekers do very well. She'd probably be home in 4 to 6 weeks. I started chemotherapy again when Sophia was 3 days old. It broke my heart that I couldn't breastfeed her or hold her as much as I wanted to, but she was alive and healthy, and that was what mattered most. Sophia came home from the NICU on her original due date, 8 weeks after she was born. She was still tiny but thriving, and David and I were completely in love with our miracle baby. The cancer had responded well to treatment again, and my oncologist was cautiously optimistic about my long-term prognosis. You've beaten the odds twice now, Dr. Kim said during one of our appointments while David fed Sophia a bottle. I'm starting to think you're just stubborn enough to keep beating them. That was 5 years ago. Sophia is now a healthy, brilliant kindergartner who wants to be a doctor like her daddy and help sick people get better. My cancer is still there, managed with oral medications and careful monitoring, but it's been stable for years. We never had Gabriel David. One pregnancy was risky enough, and we couldn't justify putting our family through that again. But Sophia is everything we ever dreamed of and more. She's living proof that sometimes the impossible is just really, really hard. People ask me if I regret the choices I made, if I would do anything differently knowing what I know now. The answer is always no. Every decision led us to Sophia, and I can't imagine our lives without her. They said I'd never have children, but they were wrong. I'm Emma Rodriguez Chen, and this is how I became a mother against all odds.